morning, everyone. This is Amanda Gallipo from Empire Justice Center. Welcome to our first of our mini-series training on Medicaid. This is Medicaid 101. I want to thank you so much for coming and joining us this morning. Okay. So this is a brief overview of what we're going to talk about today. First, we'll go over what exactly is Medicaid, who qualifies for it, what it covers, are there co-pays involved, how long should it take to actually get your Medicaid approved, anything else that you should know, any questions that you might have, resources that might be helpful for you in your practice, and then my contact information if you need to get a hold of me or Empire just at a later date. One thing that you should know is that Medicaid covers more people than ever. It used to be years ago that Medicaid only used to cover the sick, disabled, and children. But since Medicaid expanded with the Affordable Care Act, it now covers the middle ground, the childless adults, right in the middle there. So what is Medicaid? You might have heard it referred to as an entitlement program. It can be thought of as a term, but what it actually means is that anyone who meets the eligibility requirements has the right to enroll in coverage. It's a program for New Yorkers who cannot afford to pay for medical care. It's administered through the Department of Health, and you may qualify if you have high medical bills, receive supplemental security income, which is different than Social Security, and if you meet certain financial requirements. So how does Medicaid work? Generally, you may have a care plan, which means that the Department of Health pays insurance companies per member per month to cover the cost of their care, which is different than the previous fee for service model, where doctors would get paid basically for each service that they would render. So if you went to the doctor and they had to put a Band-Aid on you, the Department of Health would essentially cover that Band-Aid. Instead, they're paying the insurance company every month for however members that are enrolled. If you have Medicare and Medicaid and then also get home care for more than 4 months, you likely get a managed long-term care plan or an MLTC plan at 21. It must also cover the Medicaid benefits at a minimum. If you're interested in knowing what those are, or if you ever have to, say, for instance, cover if you're hearing or anything else like that, you can see what those covered services are in the model contract, Appendix K. You could find those in the resources as well. There are also waiver programs that are currently exempt from managed long-term care. For instance, the NHTD waiver, also transition diversion waiver, or the TBI, traumatic brain injury waiver. Those are still in fees for service, but rolled into managed care eventually. So these are the exemptions and the exclusions. Who get chronic conditions who are currently seeing a specialist who does not accept any of the managed care plans in the area. So say you're in Monroe County but say Monroe County only had Excellus and Fidelis, and those were the only two managed care plans, and you saw a neurologist who did not take those two plans, you might write to get an exemption. That's an example. Native Americans are exempted, those in the OPWDD waiver or TBI NHTD waiver. Or not an MLTC. Those with limited Medicaid eligibility, and what that means is those who are receiving care for the breast cancer treatment program, that's like a limited Medicaid eligibility program. Also the family program. Also those who are in hospice at the time of Medicaid enrollment. Excuse me. So what does Medicaid cover? Well, first, it's important to know that Medicaid coverage can be retroactive for up to 3 months. They're eligible in those 3 months of coverage. It pays for comprehensive medically necessary services. So for instance, agents, doctors, and dental services. It's important to note that the dental coverage in Medicaid can be pretty limited. Hospital, inpatient, and outpatient services, laboratory and x-ray services, nursing home care, home health agencies, inpatient psychiatric care, family planning benefits, and we're going to go do a deeper dive into both family planning benefits and the EPSDT services, medicine, supplies, and DME, clinic services, transportation, emergency ambulance, prenatal care, some insurance and Medicare premiums, and some other health services so long as they're medically necessary. So the EPSDT, I want to bring this up and just kind of shed a little light on this because if in your practice, you might see things that are denied perchance by providers, and just to kind of let you know some of the things that should be covered and maybe are not being covered. So what this stands for is early and periodic screening, diagnostic, and treatment. So states are required, and this is written in federal Medicaid law, to provide Medicaid-covered children under age 21, sorry, with comprehensive, appropriate, preventive, dental, mental health, and developmental and specialty services. So the screening should cover comprehensive health and developmental history screening, a physical exam, and it's to be unclothed so that they can get a full picture of the child, a physical exam, immunization, lab tests, and this is also to include a lead toxicity screening and health education. And the health education is also to include things like healthy lifestyle choices, such as obesity tests and all that sort of thing, like food choices and that sort of thing. Vision. So let me just back up for a second. In the screening, they'll give an eye exam as far as, cover one eye, read the chart on the wall. If the physician believes that the child might need an eye exam, that's when they refer them for an eye exam. Then the vision test, that's when that becomes diagnosis and treatment, for example. And at a minimum, they have to diagnose what's wrong with the child. So say their vision is, 50/20, and that's when they are to vision problem. That's not to say the child is to get Kate Spade lenses because they're super cute. They just have to treat them with medically necessary lenses. Then dental, that seems to be an ongoing issue, either in fee-for-service or in managed care. And I urge you to please refer cases to Empire Justice Center, Legal Aid Society, NILAG, any of the CBOs in the region with any dental issues that you're having. They're also supposed to cover hearing and before any diagnostic or treatment. And then there's the Family Planning Benefit Program. To be eligible, you need to be a female or male of childbearing age, a New York State resident. You are eligible if you are a U.S. citizen, national, Native American, or lawfully present. I didn't include too much on immigration status here because that is clearly a whole different training. But you can cross-reference this with the immigration crosswalk that's in the resource section. And then you can contact me with any questions that you may have. You're eligible if you meet certain income requirements. Currently, it's under 223% of the federal poverty level. So that's obviously a really generous income amount. And you're not currently enrolled in Medicaid, because if you are enrolled in Medicaid, you have a pretty comprehensive anyway. So it covers most FDA control methods, devices, and supplies. For example, birth control pills, injectables, patches, condoms, diaphragms, and IUDs. It covers emergency contraception services and follow-up care, male and female sterilization, preconception counseling, and preventive screening and family planning options before pregnancy, and also transportation to family planning visits. So these services are provided when they're in the context of family planning. So it does cover pregnancy testing and counseling, and a physical examination. This includes a breast exam and referrals to primary care providers as indicated. However, mammograms are not covered. Screening and treatment for sexually transmitted infections, screening for cervical cancer and urinary tract or female-related infections, screening and related diagnostic lab testing for medical conditions that affect the choice of birth control. So diabetes, high blood pressure, blood clots, that sort of thing. HIV, counseling and testing, counseling services related to pregnancy, informed consent, STD and HIV testing, a bone density scan, only for women who are using Ortho Provera, and an ultrasound for replacement of the IUD. As I said before, this is one of those situations where you're exempt from managed care. This has no copays associated with it. And with this family planning benefit, there are sites where you can go to apply right on site, and that link will take you right to those kind of places. Many of them are like like a Planned Parenthood or one of the federally qualified health centers and those sort of places. And I did just get a question, just so you know, I'm going to take questions at the end. So, so I did just see a question, so I will take that at the end, sorry. So prescription drugs. Federally prescription drugs are an optional benefit. States do cover them. New York State covers both medically necessary and over-the-counter drugs. New York has a mandatory generic dispense program, but prior authorization is required for medication that is not generic. There are some services and medications that do require copay. They're allowed to be charged, but providers cannot refuse a service due to inability to pay. Within a year, it's $200 max. Within a fiscal year, the New York State fiscal year runs April 1st through March 31st. And there's no copay on private practicing physician services, including lab or x-ray visits, home health services, personal care services, or long-term care services. So clinic visits are $3, lab tests are 50 cents per procedure, supplies are $1, inpatient hospital stays are $25, emergency rooms that are not urgent are $3 per visit. Then for pharmacies, it's $3 for brand name, non-preferred, $1 name brand preferred, $1 brand when less than generic, and $1 generic. And over-the-counter drugs are 50 cents. Those who are exempt from Medicaid copays, children under 21, residents for the Office of Mental Health, people for OPWDD, those who are enrolled in a comprehensive medical case management or services coordination program, pregnant women, and those who are 2 months after pregnancy, the family planning, any birth control, condoms, residents of an adult care facility, nursing home residents, members in hospice, Native Americans and Alaska Natives, those who are below 100% of the federal poverty level, psychotropic and tuberculosis drugs, and those in waiver programs. All right, so for eligibility, there are the two types of Medicaid eligibility levels, MAGI versus non-MAGI. The non-MAGI folks are the disabled, blind, and those over age 65. Those who are on the non-MAGI level, you apply at LDSS or HRA in New York City. Your resources are included in your eligibility determination. You have the lower income limits, and you are afforded the SSI budgeting and disregards. For MAGI, you apply at the New York State of Health. Your resources are not included in your determination, and you do have the higher income limits, and you can use that if you are in the Medicare waiting period. Generally, you cannot use MAGI budgeting if you have Medicare unless you're a parent or caretaker relative. I'm not going to read through these for you, but I did include them just in case you wanted to have them at your disposal. But here are the non-MAGI and some of the MAGI household and income levels. And then here's the family planning benefit. And then the children level goes up to 154%. And just of note, pregnant women always count themselves and the number of expected pregnancies. So if they're expecting twins, it is a household of 3. And then there's the Medicaid buy-in program for working people with disabilities. And that eligibility level goes up to 250% of the federal poverty level. You must be under age under age 65. You apply at the Department of Social Services or HRA. It's helpful if you write at the top of your application, and any amount of work can count. We've had a couple of successful fair hearings where Department of Social Services has tried to kind of fight back against the program, where people have washed cars or mowed lawns, and they've kind of pushed back and said that that's not real work. And we've won those fair hearings. So if you've seen that in your county or in your practice, those fair hearings are online. And in the resource section, there's a link to the Fair Hearing Data Bank, or you can give us a call for some information on that if you would like. So how long should it take to process an application? So for a straightforward Medicaid application, it should take 45 days. For pregnant women and children, it should take 30. And for a disability determination, about 90 days. Reasonable promptness is written into federal law, and unless you've gotten a notice explaining a reason for the delay, you do have a right to a fair hearing for your application. And there are 3 ways to request a fair hearing, but the most effective and the best way is to do it online. And I've started that here for you. If you're trying to recertify 10 days to ask for aid to continue, and you should definitely do that, or else you could lose your Medicaid. Always make sure that you're getting copies of everything when you're applying or asking for a fair hearing, no matter what. Always ask for a receipt. Remember the names of the people that you've spoken to, write everything down. Another helpful hint, when you're applying at Medicaid or DSS, one tip that I got from one of our high cap counselors, she said that she always likes to make a cover page. So if you're writing for Medicaid and MSP, she uses a cover page and just says that on top, because if you're applying with a new counselor at or a worker at DSS, they might not understand that those 2 programs might be different, or things might get lost. Or if they're new and they might not understand that an SSI applicant gets a lot of budgeting disregards, just including that might just flag the application for them. someone yesterday who said they just still don't trust it. So just double checking, making sure that you get a lot of receipts, making sure you get the name of the people that you're speaking to, and making lots of copies, making sure that you have the dates accurate of the day that you submit it, and just double checking back on your application are all helpful hints. Another hint is looking out for Medicaid patients being billed for services. They're not allowed to be billed for services. They're not allowed to be balance billed for services. And check out Medicaid Updates, Volume 30, Number 2. There are strong Medicaid protections from patients being billed. I'm flying right through. Okay, so case studies. Kasha is a pregnant 18-year-old woman living in upstate New York. She's living with her parents. The child's father, age 19, has no income, and Kasha makes $500 a month waitressing. Her parents' income is $4,000 per month. She expects to continue living with her parents and going to school after the birth of her child. Let's find out what her insurance eligibility would be while pregnant for herself and the child after. Kasha's parental income would be disregarded. If you look at GIS 14 MA 22, Medicaid eligibility for pregnant minors, basically her parents' income would be complete. She's a minor. They would only include her income of $500 per month. So she would be a Medicaid eligible for her pregnancy and after, for herself and her child. And because we're using the $3,059 amount for a household of 2, so the pregnant women eligibility amount, they would both be eligible for Medicaid. Moving on to Andres. Andres is 42 and lives alone. He gets SSD of $1,405 and is in the waiting period for Medicare. He also walks his neighbor's dog for $20 a month. What can he do about insurance? He is just over the limit for MAGI budgeting of $1,397, but he can apply at the LDSS. If we take a look at what his Medicaid level would be, he could have a 563 spend down NBI WPD program. The 250% federal $25.29, so he would qualify for Medicaid. We would write up a cover letter and apply to DSS, stating that he wishes to apply in program for working people with disabilities, along with a letter from his neighbor. Okay, so I'm going to look at my questions here. I know that they're flashing. Okay. Okay, aren't OPWD waiver services under the waiver also still fee for service? Let me go back. I think I did say that they're exempt, but let me just double check. Yep, they're still exempt for managed care. And the PowerPoint should be linked into the, if you look in the question section or on the right-hand side, if you pull your dashboard out on the right-hand side, there should be a link to the webinar. If there's not, you can email me and let me know and I can send it to you. And if you're enrolled in a managed care plan, are members responsible for co-payment? believe that you can be, but let me double check on that because I thought that you were, but let me double check on that one for you because I don't want to give you a wrong answer. And I didn't mean to fly through that so fast. So does anyone else have any questions? Okay. I will just remind you that next Tuesday, we will have the MAGI Medicaid training with Alexia. And the Tuesday after that, we have Medicaid budgeting with Jeffrey. And here are all the resources in the last pages of the handout. And like I said, if you're not able to get to the PowerPoint in the dashboard, please let me know. And that's my information. You can either email me or call me, and I will send that to you. I hope you all have a great day. Thank you so much.